So we are going to introduce the fourth new app from our cath lab, which is called the TRANSCATHAID. And I'm just going to tell you what this app is going to do. I have nothing to disclose. And we all know the US TAVR volume as shown here by almost every year, close to 50,000 of procedures being done every year. Close to 580 centers are doing TAVR, with the in-hospital mortality rate of TAVR going down to less than 1.3. And what do we know about aortic stenosis and coronary artery disease? That who has it and what's the percent and the incidence. So as shown by this paper that came out in European Heart Journal, as the age increases, the incidence of coronary artery disease also increases. And why this is important for us is in patients who are having a TAVR, we all know this is the guideline that came out saying that if they have significant coronary artery disease, of course, do PCI before TAVR. And this is, if they have symptoms also, they should get PCI before TAVR. And if they have not had PCI and they get symptoms, that is when they say that you have to do PCI maybe later. Now, this is the paper that we published from our group early part of this year, that once you have had TAVR, depending on the valve that we used, whether it is the self-expanding valve or you have balloon-expandable valve, there are several factors come into existence to decide which is a catheter that we need to use. So if you see here, why is that important? If you see aorta, it is a nice elastic chamber that you have, but now then you place this big metal valve. So what happens? The sinotubular junction diamond because of the diamond decreases. The other thing that's important is the height where you place the valve. And then what also comes into existence is a commissural tab. What is the orientation of the commissural tab when you have placed the valve? This is something that we cannot pay attention to or decide before we are releasing the valve. So all this comes into interplay if the patient is coming back for an angiogram later on. And this is what happens in everybody's brain, that when you see a patient, what is the kind of coronary catheters we need to use, the type of catheters, the type of wires, and how are we going to get access. And based on the paper that we published, we thought let's come up with an app which is called as the TRANSCATHAID. And this is just a demo of the app. If you see here, that once you open the app, what will happen is you'll decide whether you want to go to the self-expanding or the balloon-expandable valve, and then you have the home tab. This is a team of doctors who actually were responsible to make this app. And if you go back to self-expandable valve, then you go to what is the basics, applied anatomy, the toolbox, and engagement. So if you go to applied anatomy, you see based on the height of, this is just the theory, so you understand why we are explaining what catheter is needed. And this is the height of the skirt and the diamond that you think that depending on where the valve was placed, how the catheter, which catheter to select. Then what you can do is go to the valve, and then use this description step by step how you can do, or there will be an animation. And this is the animation which we want to show for the self-expandable valve, left coronary engagement. So you see here, initially you always go with the J wire, and this is what happens. The J wire could go behind the valve. So what you have to do is you have to redirect it with the help of the catheter, and you always go with the smaller catheter for the same reason, because you have the valve diamond restricting the catheter getting in. So if your J wire, you're not able to get into the appropriate diamond, you use a stiff angled glide and then slowly navigate the guide into the coronary artery. So this is the only time also when you disengage, come out in the sinus, then you go with the J wire back and take out the entire catheter. Normally we do teach the fellows that you can, when you disengage, you just disengage and come out. But in this situation, you will have to use a J wire before you come take the coronary catheter out to avoid dislodgement of the valve. This is the engagement of the right coronary artery. If you see here, same thing. If your wire is going behind the valve, pull back, and then you reorient it with the catheter so that you go right into the center of the valve. This is how you clock, get the right coronary a catheter facing the right coronary artery, take your stiff angled glide wire, then you find the right diamond. You see that you find the right diamond, get into it, and you'll enter the car. We just demonstrated the engagement with the basic catheters. The flow of the further catheters to be used is in the app. Now this is for the balloon expandable valve. How are we going to do with the left coronary engagement? J wire. The one thing about this is your diamonds are larger. So this is the JL5 catheter. You're trying to see whether you can again get into the through the diamond. If not, change to stiff angle glide. And also we say that the first row, the large diamond in the first row, try to get in through that large diamond. And this is how again you disengage and come out. You got to be very meticulous even when you're engaging as well as you disengaging. Right coronary engagement will be the same. J wire. Stiff angle glide to again once you clock, get the right coronary artery. If the J wire does not direct it, then change it to the stiff angle glide. You see that, then you direct into the appropriate diamond. This is how you disengage, come out. So our goal has been global education, and one thing great about this app is the same. We can sit in New York here right in the control room and probably educate the people all over the globe how to do this various procedures. So we came up with bifurcate, we came out with octade, transeptade, which we are going to tell you how to do transeptal puncture. This app, if you want, you can download it right now. All these apps are free. The steps of how to do transeptal puncture during our mitral case also we will demonstrate, and this is the one that we just came out today, which will be the TAVR cathode. Also we have the website for the cardiologyapps.com, where this app and several apps which are in the making will be available free to download. Thank you for your attention.